Coming up, we'll describe epidemiology. In this section, we'll review epidemiology. Epidemiology is the study of patterns of disease. For the purposes of USMLE Step 1, the most important thing to remember are the definitions of epidemiology terms. Here are some terms that are important to know about. Epidemic. An epidemic is a disease occurring in excess of normal rates. For example, the West Nile virus in the U.S. since 1999. A pandemic is a worldwide epidemic. For example, the Spanish influenza pandemic of 1918 to 1920. Endemic refers to a disease that is prevalent in a particular geographic area, such as malaria in sub-Saharan Africa. Prevalence. Prevalence is the proportion of individuals in a population with a disease at a given point in time. The prevalence, therefore, equals the number of people with the disease over the number of people in the population. So, for example, in 2001, the prevalence of obesity in Texas was 23.8%, or 238 per 1,000 population. It's important to remember that prevalence is a cross-sectional definition. It does not account for the new cases over time. In contrast, incidence is a proportion of individuals in a population that are newly diagnosed with the disease over some period of time. So, for example, the incidence equals the number of people diagnosed with the disease per year over the number of people in the population who are at risk for that disease. Now, incidence does not necessarily have to be defined per year. It could be defined per month or for other units of time. So, for example, in the U.S. in 2001, 459 people were diagnosed with cancer for every 100,000 people at risk. The incidence was approximately 0.5%. So when it comes to prevalence and incidence, one should be able to answer some of these common questions. For example, how do the prevalence and incidence change if a cure were discovered, an effective prevention like a vaccine is discovered, an effective therapy prolongs life but does not cure, or if person-to-person transmission is decreased? So, for example, if a cure for disease was discovered, this would not alter the incidence of that disease, because the incidence refers to newly diagnosed cases. But because each case of the disease would last for a shorter period of time, any cross-sectional assessment of the frequency of that disease would be lower. Therefore, the prevalence would be lowered. In the next example, if an effective prevention was discovered, this would both decrease the rate of the development of new cases and therefore would decrease the incidence, and would obviously decrease prevalence because less people would have the disease at any given time. In the third case, if there was an effective therapy that prolonged life but was not curative, this would not do anything to the incidence because, again, incidence refers to newly diagnosed cases. However, since each individual case would last longer because the patients would live longer, the prevalence of the disease would actually increase, because prior to the establishment of this therapy, it's implied by this question that people with that disease would die sooner. Finally, if person-to-person transmission is decreased, this is effectively the same thing as decreasing the frequency of new cases, and by doing so, this would decrease the incidence, and any intervention that would decrease the incidence by decreasing the number of cases would also decrease the prevalence. Practice question. Translational researchers have developed a new chemotherapeutic drug that appears to have beneficial effects in prolonging survival in patients with pancreatic cancer. If this drug is approved by the FDA following clinical trials, which of the following will occur with respect to pancreatic cancer? We can think about this question in the same terms that the previous slide described in terms of the effect of altering survival time on incidence and prevalence. The incidence in this case should not change because the question does not state anything about the change in the diagnosis or the onset of this disease. However, the prevalence would increase because the disease process being described, which is pancreatic cancer, is commonly fatal. And here we have a situation where life or survival would be prolonged. In this case, the prevalence would increase and the incidence would stay the same. So the correct answer here is D. Practice question. In a city with a population of 1 million, 10,000 individuals have HIV disease. There are 1,000 new cases of HIV and 200 deaths per year from the disease. There are 2,500 deaths per year from all causes. Assuming no net emigration from or immigration to the city, the incidence of HIV disease in this city is given by which of the following? So recall that incidence refers to the number of new cases divided by the number of people at risk for the disease. Here we have a population of 1 million people. However, 10,000 already have HIV. Therefore, the population at risk would be 1 million minus 10,000, or 990,000. At this point, we have the appropriate denominator. In terms of the number of new cases, they tell us the number of new cases, and that's 1,000 per year. So that 1,000 would be the numerator. There's some irrelevant information given here about the death rates from the disease, which have no impact on the incidence. So the correct expression to get this answer would be 1,000 divided by 990,000. Prevention. There are several different types of prevention. Primary prevention refers to the prevention of the onset of disease in healthy but at-risk individuals. So for example, anti-smoking campaigns or seatbelt laws. So primary prevention's role is to decrease the incidence of disease, meaning decrease the rate of new diagnoses of disease. And as mentioned previously, any intervention that decreases incidence will also decrease prevalence. Secondary prevention, the goal here is to increase chance of cure in a diseased population. So for example, early cancer detection, finding the cancer at its earliest stages, such as pap smears, mammograms, PSA screening, etc. Secondary prevention decreases the prevalence of disease and decreases the incidence of a targeted outcome. Targeted meaning the poor outcomes caused by a particular disease when caught in its earliest stages. Tertiary prevention looks at people who already have the disease and attempts to minimize the morbidity associated with the particular disease. For example, in diabetes, we know that tight glycemic control, regular eye exams, or podiatric visits can decrease some of the complications of diabetes. None of these will alter the incidence of diabetes. However, since some of these interventions may lengthen the lifespan of people with the disease, it may actually increase the prevalence only if mortality is decreased. That concludes our discussion of epidemiology and of biostatistics overall.